Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating and rare case in veterinary medicine, the successful surgical removal of an ependymal cyst found in the fourth ventricle of a dog's brain. This groundbreaking case is brought to us by Isabel Liningrena, Alba Ferre Marine, Marty Pumarola I Battle, and Alejandro Lujan Feliu Pascual. Ependymal cysts are rare congenital brain malformations, more commonly documented in human medicine, where surgery is the preferred method of treatment. In veterinary medicine, there have only been 3 prior reports, with only 1 instance of partial surgical removal. This case report details the first successful complete resection of an ependymal cyst in the fourth ventricle of a dog, along with its long-term outcome. Our patient is a 6-year-old male American Staffordshire Terrier who presented with a 4-month history of incoordination, collapsing episodes characterized by extensor rigidity and positional left horizontal nystagmus. A thorough neurological examination pinpointed the problem to the left central vestibular system and cerebellum. To get a clearer picture, a computed tomography scan of the brain was performed. The scan revealed a hypoattenuating lesion, showing peripheral contrast enhancement residing in the fourth ventricle. This was consistent with a cyst and was causing secondary hydrocephalus, an accumulation of fluid in the brain. Initially, the dog was treated with prednisone, a steroid medication, which led to some improvement. However, the neurological signs returned, making surgical removal of the cyst necessary. The surgery involved a suboccipital craniectomy, a procedure to access the brain by removing a portion of skull. The cyst was carefully drained, and its capsule was meticulously resected. Post-surgical computed tomography scans confirmed the complete removal of the cystic tissue. The excised cyst was then sent for histopathological evaluation. The findings revealed a simple cubic to cylindrical epithelium with apical cilia, surrounded by loose fibrillar tissue, which confirmed the diagnosis of an intraventricular ependymal cyst. Immediately following surgery, the dog experienced neurological deterioration, including severe vestibulocerebellar ataxia, non-ambulatory tetraparesis, and severe spontaneous left horizontal nystagmus. However, with diligent post-operative care, the dog's condition gradually improved. The treatment included medications such as cefazoline, meropitant, beta-histine dihydrochloride, and dexamethasone. Within 24 hours, the dog was able to walk with assistance and was discharged 4 days after surgery. At the 6-week recheck, only a slight cerebellar ataxia was observed. Remarkably, 4.5 years after the surgery, the dog exhibited an excellent quality of life, with only occasional, brief episodes of balance loss when making abrupt turns. This successful outcome adds valuable insights to the understanding and treatment of ependymal cysts in dogs. True intracranial cysts, as observed in this case, are closed epithelium-lined sacs or capsules within the cranial vault, containing fluid or semi-solid substances. These cysts can trigger neurological signs either by directly compressing brain tissue or by obstructing the flow of cerebrospinal fluid, leading to hydrocephalus. Cysts in dogs can vary, with different types identified based on the origin of their lining cells and the nature of their contents. For example, Epidermoid cysts are characterized by a lining of stratified squamous epithelium, accumulating desquamated keratinocytes, keratinaceous debris, and cholesterol in the lumen. Dermoid cysts contain epidermal adnexal structures like hair follicles, sebaceous and apocrine glands, and fat. Choroid plexus cysts are lined by choroid epithelial cells and typically contain a clear, cerebrospinal fluid-like substance with a higher protein content. Ependymal cysts, like the one in this case, possess thin walls and are filled with clear serous fluid secreted by ependymal cells. Imaging techniques, such as magnetic resonance imaging and computed tomography scans, play a crucial role in identifying these cysts. While cysts often exhibit similar characteristics on these scans, histopathological analysis remains essential for a definitive diagnosis. Prior to this report, only 3 cases of ependymal cysts in dogs have been documented. These earlier cases, along with the current one, contribute to our growing understanding of this rare condition. The location of the cyst can significantly influence the clinical signs observed. In this case, the cyst was located in the fourth ventricle, an area in the caudal fossa, which is consistent with previous reports. The clinical signs, including ataxia, head tilt, and postural reaction delays, were also in line with earlier findings. In veterinary medicine, treatment approaches for caudal fossa cysts have varied. While surgical resection is favored in human medicine for symptomatic patients, veterinary cases have included medical management and euthanasia. In cases where surgery is pursued, complete removal of the cyst is often the goal. The surgical approach used in this case, a suboccipital craniectomy, mirrors the technique employed in human medicine for ependymal cysts in the fourth ventricle. This case stands out due to the successful complete removal of the ependymal cyst and the dog's long-term survival and improved quality of life. It reinforces the importance of including ependymal cysts in the differential diagnosis for cystic masses in the fourth ventricle of dogs. Despite initial post-surgical neurological challenges, the dog's clinical signs improved, suggesting that complete excision can be a curative approach. The authors advocate for considering complete surgical removal when feasible, drawing from experiences and recommendations in human medicine. This case contributes valuable information to the veterinary field and highlights the potential for successful outcomes in treating this rare condition. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.